Yes, thank you, Jess. It's a real pleasure. Let me just first put the context again to remind people who haven't been following the Save Lives work. We still have 1.3 billion people using tobacco in the world. They're dying prematurely at the rate of 8.5 million a year. So this is a big public health problem. In the Czech Republic, which has a relatively small population of 10 million people, about a quarter of the adults, about 240 million people, smoke. And if we look at the men and women, about a third of adult men smoke and about 25% of women. Both put them in the higher categories of smoking, both in Europe and globally. And the smoking rate among women is particularly worrying. It's about the highest that we have in the world. Um, as a result of this, it's not surprising the death rate is so high. About 18,000 people in the Czech Republic die every year of the major causes of tobacco death. Against that background, we set out as a group of international experts to work with the folk in the Czech Republic to ask the question, how many lives would be saved over the next few decades beyond those who we expect to be saved through the traditional WHO framework convention approaches? In other words, continue the work on taxes, continue to address advertising, marketing to kids, and so on tobacco products. But if we were to add in tobacco harm reduction and ensure that it was made more widely available, if we were to use what is emerging as better forms of smoking cessation, and if we were to address the largest cancer cause related to tobacco, namely lung cancer, through better medication, what would we actually see in terms of lives saved to 2060? We did this by using a range of different modeling epidemiological study, and you'll see that the assumptions are very well outlined in the report, and we encourage people to look at them. We drew upon fairly conservative estimates, so we're not trying to overinflate the data, and we believe that whatever we say is probably an underestimate of what's likely to happen, given the rapid pace of us now having even better harm reduction products. So what do we mean by tobacco harm reduction? We referred particularly to the emergence of a range of products that have been shown to remove the combustion, which is the reason we die, as well as the toxic substances in smokeless tobacco. And they include particularly vapes or e-cigarettes, heated tobacco products, nicotine pouches, snus, and increasingly we're starting to see shisha, water pipe, particularly e-shisha, starting to appear also in the Czech Republic. We looked at 2060 because it's a realistic time to start seeing real impacts on long-term effects. And remember that tobacco takes a long time to have its effect on populations and a relatively shorter time to start seeing the benefits. And our main interest is in adults. We don't go into it, but the report implies that we do not support the access of either any tobacco product or nicotine product for youth or teenagers. So in doing the study, we were able to show that if we were to give better access to the tobacco harm reduction products, the current figure of about 18,000 deaths a year was estimated to drop to 12,000 under the status quo approach of WHO. That means steadily increasing taxes and regulations and so on by the late 2050s. Remember that figure, 12,000. We estimate that that could go down to under 5,000. So a huge drop per year. And if you then calculate the cumulative benefit of all those deaths being saved, lives being saved over the decades, we come to a figure of over 250,000 lives to be saved before 2060, or to be more exact, 280,000 lives to be saved in the Czech Republic. To put it in context, there is no other public health measure that you can think of that would save 280,000 lives, or even that comes close, whether it's antibiotics or whether it's vaccines or whether it's treatment of hypertension or diabetes or whatever it is. This is a mega number that should bring a reduction in massive suffering, pain, economic costs, and so on. So if that's the case, what would it take to actually make it happen? The good news, and what makes this particularly interesting in the Czech Republic, is that as far as I know, this is the first country in the world where they have deliberately integrated tobacco harm reduction into their national strategy of harm reduction. What do I mean? I mean that when they address things like alcohol, drug abuse, HIV/AIDS, they use risk proportionate regulations. They decriminalize people and put the focus on the treatment and the human rights needs of individuals, whether they're using drugs or alcohol or maybe having unsafe sex. The same basic principles are being applied to tobacco. And in the last year or so, they've been strengthening the integration to make sure that they have a coherent approach, which basically says we could be applying harm reduction, particularly in these complex areas of behavior, to help people really move away from high risk to low risk and maybe ultimately to no risk. And we believe that that is a sensible way to go. In that context, all of the major tobacco harm reduction products are available on the Czech market. The regulatory environment, it's varied, but generally all of them are legal to some extent. Even snus, which is banned across the EU and they are a member of the European Union, is permitted for personal use. So it can be imported, even though it can't be sold on the streets of the Czech Republic. Nicotine pouches, vapes, heated tobacco products are all widely available. Interestingly, the taxes and pricing on heated tobacco and e-cigarettes favor the use of the safer alternative, heated tobacco and e-cigarettes, against the combustible version. And similarly, the messaging generally coming out is more positive. Now, this has only been in effect for a relatively short while, and we believe it'll take a while to play out. And as you can see, still with a smoking rate of 33% among men, 26% among women, we've got a long way to go. We believe that there's a real chance that this could become a message for the rest of Europe and the rest of the world. And we're hoping that that'll be a message that our colleagues from the Czech Republic will carry forward. Clearly, the role of physicians, like in all of the other countries, is fundamental. And we particularly believe that they play a central role in advising their patients about the value of heated tobacco products, vapes, snus, nicotine pouches. We hope that we'd see government invest in more research locally. We've already seen that the private sector has been carrying out very important research showing the benefits of heated tobacco products as giving us results on reducing and switching far greater than you often get even from nicotine replacement therapy. And finally, I'd say that for the ownership to be felt by the people of the Czech Republic, we need to see an equivalent of the Royal College of Physicians report, which is led by physicians and the academy and lays out the benefits to the population as a means of stimulating doctors, physicians, and nurses. And we know that there are very powerful academies in the Czech Republic, the Czech Academy itself, that actually do this very well, and we believe it'll have a big impact.